So I think we are ready to begin. I wanted to give you all a warm welcome. Thank you so much for taking some time out of your day today to come be with us. I am April Borden, the Executive Director here at the community, and I'm so excited to see so many people. This is a great event. So this event today will be focused on our healthcare. So our healthcare panel will be sharing a little bit about healthcare here at RiverWoods. So thank you so much again for coming, and I'm gonna hand it over to Katie, who's gonna lead us through today.
Hi everyone, can everyone hear me in the back just fine? Okay, so welcome. My name is Katie Hendrickson. I'm one of the sales counselors here. Some of you know me, some of you don't. But basically, you know, this is an event for absolutely everyone. And so people may have a good knowledge of RiverWoods already, and some people might be just starting out. So we're gonna cover a little bit of it in the beginning, and then we'll go straight into, you know, the heart of our presentation. But a little bit of housekeeping. So please make sure that everyone's phones and devices and things that beep and ring and make funny noises are turned either to vibrate or silent. Restrooms are just down the hall this way, and to the right, there's signage, so feel free to use them at any point. And then on everyone's table, there are note cards and pens. So if you have any questions at any point, feel free to write them in as we go. And then at the very end, we will be collecting them. So you just raise them up, we'll come around and get them. And then we'll do a Q&A, and we'll address the questions to whomever is appropriate. And then lastly, and most importantly, we always look for feedback. So if you have suggestions on how to improve this event, or if you have topics for the future you'd like us to kind of focus on, feel free to let us know. We always look for, you know, newer and better things, and we want to do what's useful to you. So, look, it's me. So again, I'm Katie. I'm one of the senior living sales counselors here. I work with my coworker Jen, who just went out the door. But at the end of this, if you have any questions about RiverWoods, definitely pull us aside, and we'd be happy to help answer. If you haven't gotten an information packet, or you know, aren't on our newsletter, things like that, definitely reach out, because that's a great starting point too. All right, so for those of us that are new, and for those of us that want just sort of a refresher, you know, what are we? So we are what's called a continuing care retirement community, and we abbreviate that to CCRC just to be a little bit faster. But basically it's two parts. It is an insurance product and a lifestyle choice. So what do we mean by that? The insurance product is super important. You know, as we get older, we have a lot of what ifs. And so how can we get ahead of that? So a CCRC answers a whole series of questions that maybe other styles of community can't. So basically, it is prepaying and ensuring your care needs if and when you need them. It's not that you need them now or anytime soon, but it's you making sure that there is a safety net. So at a CCRC, you may be able to answer, you know, where is my care coming from? Who's providing that care? What are the standards of that care? And is it guaranteed? And that's really special. So, you know, here at RiverWoods, our contracts are regulated by the state of New Hampshire and the state of operation. In order to prepay and ensure your care needs, there is an entrance fee and a monthly fee. So we will talk more about that as we go along, but those are sort of the two financial components to our community. So that's all the happy stuff, but the more fun stuff is that it's a lifestyle choice. So what you're doing as a resident here is, you know, making sure you have everything available to you. You don't have to worry about getting up on ladders and clearing gutters, you know, mowing the lawn in 95-degree heat, you know, clearing the snow, because we do live in New England. But it's all of that taken care of so that you can enjoy your life. So you move in as an independent living resident, and then everything is set. You don't have to worry about electric bills and all of those things that make us look and then go. But, travel, have fun, enjoy your life as you are, and just know that you have that peace of mind for yourselves and your loved ones, and enjoy it. So a little bit about RiverWoods specifically. There are CCRCs all over, but RiverWoods began for these two ladies you see on the screen, which is Mariana Hatch and Rosemary Coffin. They started the community literally at a breakfast table. They wanted to know that they could go travel and live their lives as they were, but have that peace of mind of care in the future. So they wanted to create that system that makes getting older better. So they founded RiverWoods Exeter, specifically the Woods campus. And over 30 years, we have become quite an entity. So we have now become a family of 3 dynamic not-for-profit communities. So Exeter now has 3 campuses, the Woods, the Ridge, and the Boulders. Manchester was the second community to come online, and it was an affiliation about 7 years ago now. And then Durham is our newest community, going on about 4 years. So together, we are RiverWoods. We are advised by a CCRC board, which is full of volunteers. And then we have our CEO, who sort of oversees all 3. And then we have a system board of directors, which focuses on growth and how can the 3 communities improve and move into the future. The CCRC board focuses on operations. Does that make sense to everybody? But apart from our 3 communities, we also have the RiverWoods group. And this is sort of our parent oversight. So the RiverWoods group provides fee-based services to each community. So that's, IT, finance, marketing, etc. They also fund the potential at-risk projects that may occur. So they kind of help support that. And even though each of our 3 communities is financially independent, they have the opportunity to provide additional funding to the RiverWoods group if there's available assets. So together we function as a great family and support one another, but at the same time are individual communities in terms of, safety for the future. So here at RiverWoods, there is a huge variety of services and amenities. These are just some of them. So if you have any questions on what else there is, definitely call myself, call Jen aside, and then let us know what questions you have. But one of the things taken care of is dining. So if you can't stand making another meal, you don't have to worry about that. At the same time, if you love to cook, we have full kitchens here. But it's flexible, so our dining plan fits every lifestyle opportunity. If you go traveling for a week, you don't have to worry. Our dining plan is based on points, so you can roll over some, it fits every opportunity. I did talk about inside and outside maintenance, so you don't have to worry about if your dryer breaks. We will come and fix that for you. There is bi-weekly housekeeping here, and then a range of transportation opportunities. So we go to different zip codes on different days, and if you have an appointment that lands in that zip code, feel free to use our transportation. You can have your own car here too, so it's really up to you. Also great if it's snowing outside, you don't have to worry about it. We have a range of fitness classes here. We actually have a group going on a walk right now because we have our unofficial backyard, the Cedar Swamp Preserve, which is 640 acres. But whether it's yoga, we're trialing TRX, Be Fit, there's a whole range of opportunities here. And then there's about 30 different committees that you could be a part of if you want. And then, like I said, all bills, with the exception of a landline phone, are taken care of. You don't have to worry about heat and hot water. heating and cooling, it's all covered in your monthly fee. But most importantly is you have that safety net of healthcare. And so this lovely panel is going to talk more about that. So before we get into our panel discussion, here at RiverWoods Manchester, we have what is called a Type B contract. So going back to when I said we had an entrance fee and a monthly fee, our entrance fee is the first 70% flexible entrance fee in New England. So you can leave that 70% refund to your estate, your beneficiaries, but you can also use some of that in your lifetime. And the way that you use it is on the monthly fee for care. And if you have more questions on that, definitely pull us aside. A Type B contract offers a more affordable, lower entrance fee and monthly fee to start. And once, if and when you need assisted living, memory support, or nursing support, that monthly fee is discounted, and that is written into our contract, and that's for your lifetime. Couples or duos get a great advantage because it is not 2 full entrance fees. There's a significantly decreased second person entrance fee and monthly fee. So if you're part of a duo, it's something to consider when looking at communities. And then here at RiverWoods Manchester, we take great advantage of long-term care insurance. So if that's something you have, it's not a necessity, you can use that. And so you would pay RiverWoods your normal monthly fee and then get reimbursed from your long-term care insurance plan, depending on the specifics of which plan you have. But basically, it provides an ability to have greater predictability of cash flow during your lifetime. So there are 3 different contract types within the realm of CCRCs. So if you want to go over the comparisons between them, just let us know. So enough of me talking, but this is our panel. So I'd like to introduce them. And we're going to go down the line in terms of roles, responsibilities, what's available in the community. And then, we will do a Q&A at the very end. So just a reminder that everyone can write on their note cards if anything pops up in our presentation. But we have Karen McDonald, who's our nurse practitioner here. You will get to know her really well as a resident while you're starting out in independent living. We have Felicia Gennetti, who's our director of community life. So she is everything and anything, basically, involved in what's happening here. We have Donna Hannon, who is our director of health services in our healthcare side of the community, which is called The Lodge. We have Cindy Martin, who is our chief clinical and quality officer for the RiverWoods group. And then we have Barbara Feloney, who is the director of community relations and referral development for the Manchester VNA. So if you have any questions about VNA services, definitely a great person to ask. And then last but not least, we have Jessica Plante, who is the regional clinical director for CPTE. And she's going to talk more about, what CPT is and how, we have a relationship in our hydrotherapy pool. All right, so I'm going to hand this over to Karen.
Hi, thank you. Welcome. It's nice to see everybody, some familiar faces. Really, you're in a wonderful place. It's a fabulous community. My name's Karen McDonald. I'm the nurse practitioner here. I've been here about a year. My anniversary is coming up on September 28th. I remember the first day I started, and I've loved every day since I started. A little about myself. I graduated from Riviera University, so anybody from Nashua would be familiar with that. I've been in family practice for 3 years, and I've been here for 1 year. Prior to that, I've had over 20 years of nursing experience. I worked in home health, I worked in long-term care, assisted living, memory care, hospice, so I had quite a variety of experiences. Here at at RiverWoods, our wellness clinic is open 5 days a week. Our goal is to provide you with medical access while you're here. So mainly in treating acute care symptoms. If you have something going on and if I can avoid having you go to a local walk-in and treat you within the facility, I do my best to do that. We also offer, I also assist if there's any need for our respite services from independent living to the lodge. I can help with transition there. I can help facilitate if you need any help with your primary care or getting orders, things like that, VNA services and assisting in getting orders that way. I touch base a lot of times with specialists and your primary care. I also am the person that does the screens, so many of you may have already met me in that regard. I join forces with the fitness coordinator, and we provide monthly presentations for educational purposes, so I am active in that as well. I also provide a monthly newsletter and a calendar, so if anything's going on medically in the community that you might need to know, or there's new resources that are available to you, I try to keep you abreast of those situations. In the wellness office, we also have enhanced living services. So I have 2 LNAs that are available to help with personal needs. So that can be anything from helping with care in the morning, or helping prepare meals, or helping with laundry, grocery shopping, errands, things like of that nature. In the wellness office, we also have some outside resources that come in. Podiatry is offered here at the community. Dermatology also comes in once a month and works out of the wellness office. Both CMC and Elliott also provide service here at RiverWoods. And then I will leave physical therapy and occupational therapy to the ladies here to introduce themselves. And we also have audiology here to assist those with hearing. So if there are any other resources or services you'd like to see within the community, we're always looking for ideas or ideas for presentations as well.
Good morning. My name is Felicia Gennetti. I'm the Director of Community Life. So our department consists of activities and trips for independent living and activities and trips for the lodge. Our team is called Life Engagement. We also have our reception team, we have transportation, we have resident IT, we have fitness, the salon, and we have a massage therapist. So our job is to provide you with as much fun and opportunities and growth in whether your mind or your flexibility with our fitness team, and to kind of be there for whatever you may need in that sense. We work with the resident committees. We have a committee called ELF, the Exploration, Learning, and Fun, and they bring in speakers. We have the Wright Museum coming up in 2 weeks. And then we have another resident committee called TAG, which is the Trips Advisory Group, and they brainstorm and help plan places to physically go. We are going to a festival this weekend, and just different things that would actually be of interest for our community. And then I also work closely with Karen and Donna and our social worker, Kelly Spiak, who is not here today as she is on maternity leave with her baby boy. But so we work together to, help residents. If you have questions about the lodge, our respite, which all residents have 30 days of respite each year. So that could be for a planned knee surgery potentially, or if you have an unplanned hospital, Kelly will work with you to bring you back and help you get settled back in to be on your feet and back to your independent life. And then it's also questions of, if there's other services you need, and we can connect with life with enhanced living. So our department's here to just support and direct to the right people if you need it, or just be there if you have other questions. You'll see our reception team daily they have answers to every question that you might throw at them. But and then our job is just to keep you in touch. We have our resident portal called Vibrant, so that will always have updated information. It has our calendar of activities and events. If we're doing our flu clinic, we'll provide the information directly through there, and of course directly to you as well. So we're just keeping you in the loop and expanding based on what you want and what you need. Thank you.
Good.
Good morning, welcome everybody. My name is Donna Hannon. I'm the Director of Health Services in the Lodge. I've been a nurse for over 4 years. I was born in Buffalo, New York. I won't say anything about the Buffalo Bills. I was told not to talk about football team. My friend in the back, lunch with you. And now currently I have 4 children that are all adults and we live in Bowdoin, New Hampshire. They're all out and about in the community. To tell you about the lodge, we have access for what Felicia said is a respite visit, which allows residents from the independent living section to have 30 days of 24/7 nursing care. Also, we can access that for if you're having a minor procedure done. You might access that post-op for surgery. And sometimes you might require a skilled service, which requires maybe more rehab. So you might decide, well, I've had rehab in 6 weeks at a local nursing home. I think I still need a little bit more respite care. So you can also access after you have an acute stay at a hospital, taking you to a nursing home level of care, which is skilled therapy. And then you might say to Karen or myself, I'm actually covering part of the job for Kelly. So you contact me and say, Don, I think I really need a couple more weeks coming out of a skilled setting. So you have up to 30 days for that. The admission process has consents. So either Karen or myself will come up, either go to the hospital or we can go to your room if you're going to be accessing respite in like December. We can do the paperwork before you actually come over. Once you come over, all your care will be provided by the nursing team. As I said, it's all 3 shifts. We'll be giving you a pendant to access in case you need some assistance. And we want the transition for the admission from either outside nursing home or hospital or from IL to go smoothly, so that all of us work together to make that transition go smoothly. Any questions? Take it. Thank you.
Good morning, everybody. So happy to see you all here today. I'm hoping to get a little bit of credit. My parents lived in Buffalo, New York. Do I get anything for that? My dad served in the FBI there. Maybe I get a little. So I'm Cindy Martin, and I have been with RiverWoods since 2004. So just coming on 19 years actually now. And prior to RiverWoods, I primarily worked in emergency medical care, drove an ambulance for about 10 years in Lawrence. So I like to think that I've seen a thing or two, and taught in the nursing program at Northern Essex Community College, and really worked in primarily skilled nursing rehabilitative environments. When I came to RiverWoods, it was the first time I had an experience with a CCRC or what we call now a life plan community. And honestly, I have never looked back because the model of care just makes so much sense to me. Since 2004, well, in 2004, when I joined RiverWoods, I actually opened our Ridge campus as the director of nursing. And then in 2012, became the vice president of health services for the Exeter community, so for all 3 of our campuses. And then in late 2019, joined the RiverWoods group, our parent group, as the vice president of quality, just before a global pandemic hit. So that's pretty much what my focus was for a few years, honestly, with all things COVID, leading our communities through the pandemic. And then most recently promoted to Chief Clinical and Quality Officer. I'm told that's a title change, not so much a role change. So we will see, and fingers crossed, there hasn't been a global disaster since I started this role. With the COVID is not over, that's certainly still an area of my responsibility to provide support to all of our communities in that area. But really, I think probably the best part of my job is focusing on our collective goal, which is to provide support and opportunity for all of our residents to live your best life, however you define it at RiverWoods, and support you with your healthcare needs. And that looks different for everybody. I've heard this morning that, some folks here are really interested in our trails, and some folks are interested in not being responsible for an entire household anymore, and really everything in between. And that's what we're here to do, is to provide you the support around that. I think we do that through what I call the RiverWoods difference, which is really our commitment to partner with you and all of your healthcare needs. We we subscribe to and provide person-centered or person-directed care here, which is really a commitment to a philosophical approach to care, which is not based on really the medical model. Trust me, clinical outcomes are very important and we focus on that, but what is really important is relationship and how we make you the center of what it is that you want and what is important to you. So it's really an approach where it's based on values of respect and choice and preferences and wishes in all of your healthcare and lifestyle needs. I think this is kind of natural to who we are. You saw Mariana and Rosemary, who were our founders, and we were built by residents for residents. So voice and choice has always been part of what we do. It's just natural to who we are. That's the best and fun part of my job. The other kind of nuts and bolts of my role are really to be kind of the lead in all things regulatory, compliance, quality assurance, performance improvement, and risk management. So those don't always sound like the most interesting things, but they're incredibly time consuming. So I take the lead on that so that our folks here can really focus on you here at RiverWoods. I have been told before that from a regulatory perspective that long-term care is the most regulated industry, only second to air traffic control. I believe that to be true. So really it's my job to kind of take that burden off of trying to navigate what is a constantly changing regulatory landscape, which was only accelerated by a pandemic. So you kind of identify the laws, the rules, the regulations as they change and work on process and system development so that, you know, our folks here can focus on what's important. Also help lead and provide support on any quality assurance, performance improvement efforts. And, you know, as far as risk management, you know, we are part of a risk retention insurance liability group called Caring Communities, which doesn't sound terribly interesting, with the exception of they only insure lifetime communities and they only insure top performing lifetime communities. So, you know, we have to be on our game all the time. The other great part of that is that they also support us in providing resources for evidence-based practice, which we can kind of roll out into all of our processes and systems and how we approach care. So really those are the things that I'm responsible for, really just supporting the folks who are doing the kind of the heavy lifting every day. Okay.
Where do I click? Right here? No, maybe facing. I'm learning to work the clicker. I'll be right with you. Okay, thank you. Hi. What button was it? The top one? Hi, everyone. I'm Barbara Feloney. I'm with the VNA of Manchester, and it's nice to be here today. We wanted to start out with our mission statement to kind of tell you who we are, and that's advancing care at home through personal empowerment and compassionate, exceptional service. And what does this really mean? This means our goal is to really help people engage and learn about their health, keep them out of the hospital and keep them healthy. So that's really what we do every day. Did I shut it off?
You in charge clicker next.
Is this on?
You just have to just put a little closer. I know, right? It's.
Can you hear me now?
Yes.
Okay. All right, now, so I just want to tell you a little bit about the VNA. So we are a not-for-profit agency. We've been around for over 100 years in the Manchester community. The nice thing about home health is that we provide services for you right in your home. So that would be right here in the RiverWoods community. We do require a physician order for services, so we work along with the physician. And there are many reasons that you may need home health. Maybe you have an elective surgery that you have scheduled. And as you probably know, many of the hospitalizations now are very short, and people actually recover from at home from their surgeries. So you may need us for a PT, you may need us for home health, you may have gone to your doctor's office and had a change in your medications. Maybe you need help learning about those. Maybe you have a chronic condition. All of these things would qualify you for home health services. We do work closely with physicians, and as I said, once we get the order, the clinician would call you and arrange a time to come and visit you, for a time that's convenient for you. And they would do a complete assessment when they come in, the nurse or the physical therapist, determine what your goals of care would be, and then devise a plan for you. You would know how long this would be. The visits are usually a couple of times a week, and they would stay in touch with your physician to keep him apprised of your progress. Okay, she's got the clicker. Okay, good. All right, that's good hands over there. So some of the services are nursing, physical therapy, as I mentioned, OT, speech therapy, medical social workers, and home health aides. Our services are covered under Medicare Part A and also other commercial plans that we are contracted with. We have a telehealth monitoring program. So when the pandemic came about, telehealth became very popular and people were able to visit their physicians at home through this different format. So we also have that. We have a telehealth nurse who can help monitor patients that may have chronic conditions that may need more oversight. So that's a wonderful service that we have. Wound care and IV is also available if you need something like that. As far as PT goes, we have a dedicated team that comes to RiverWoods, and they work very closely with the staff and the community here. And we have one in particular, his name is Stephen, who's pretty well known, that kind of everyone wants Stephen. So we have a great relationship with RiverWoods. We also provide hospice services, which is end-of-life services. We have a very robust volunteer program. And actually, one of our volunteers here today, I see sitting at the table. And so our goal is to really support you in whatever your needs may be. And I guess I would just end it by saying, if and when you need care, it's good to know that we're here for you. And with that, I'll pass it to you. Good luck with the clicker.
So, Phil, I'm just gonna turn a little bit. Hi, I'm Jessica Plante. I'm a doctor of physical therapy. I've been with CPTE now for 7 years, over 7 years. I was actually promoted to a clinical director a week before the pandemic, and everything changed. So it's funny that she kind of brought that up. But you know, as specifically a physical therapist that has been more specialized in the aging population, I am very excited to be a part of the team here now at RiverWoods. We were very, very lucky to get a phone call about the HydroWork tank and partner with RiverWoods. So this is how we kind of entered this year into RiverWoods, and RiverWoods has this amazing HydroWork Rise tank to provide aquatic therapy and exercise to the residents. CPT has been assigned the management of this, and all of our therapists and exercise specialists have all been trained in aquatic therapy. We also, you know, we do a very thorough evaluation to make sure you're appropriate, go through red flags. I work very closely with Karen in consultations with this program. And then once, you know, you've kind of progressed off of skilled services, then there are private pay fitness options available to continue use of this HydroWorks tank. The cool thing about this tank, it seems small, but I will tell you, after using this for a long time along training, is there's not much in this tank we can't do that you can do in an aquatic pool. It has an integrated treadmill that this is patented by the company, and it helps promote early range of motion. It allows an improvement in your walking mobility with less impact, therefore less joint pain. It helps us replicate the appropriate movements a little bit easier because you have that water assistance and the warmth. It also helps improve your cardiovascular stamina and cardiovascular system. So it also can help reduce edema because your circulation improves. And it also increases healing and strengthening of injured tissues and allows for your muscles to exercise in a reduced pain environment. And I think the next slide, we actually have some residents using it. So I put a little collage together for some awesome residents here that were willing to let me take pictures. And it has just truly been amazing. You can see that there's actually a seat in there So we can do seated exercises, we can work on sit to stands with some weight bearing support. The treadmill, you can see, it can either be on or off, so then we can be doing standing exercises. We also have a flotation belt in that third picture that allows us to do non-weight bearing things, but there's still a bar there, so you can kind of progress into using that. We have lots of weights, equipment, aquatic tools to use in here as well to progress you. So a little bit about CPTE. We also provide physical therapy, occupational, and speech therapy services to RiverWoods, but we are Part B. So after you see the wonderful staff like Steven, I have seen him, he is great, and we do communicate a lot. You know, when you have home care needs, that's very, very important, but then when you go into more the outpatient, instead of having to go to a clinic or drive somewhere, we're right here for you. So we do outpatient focused physical therapy, occupational, and speech therapy for the community here. A little bit different, we do not need initial referral from your PCP. What we do is we do an evaluation, and then we send that evaluation to your primary care. So they're in the loop, and then they'll sign off on that eval that acts as the orders. So it's just a little bit different for Part B. We also take a lot of Advantage plans and commercial plans, but we're really excited. Our mission at CPT, we are very, very lucky to be in about 15 communities in New Hampshire and about, I think, 6 now in Massachusetts. And our biggest focus is helping people age in place and stay independent, or enjoy their life and have good quality of life.
All right, so let's give a hand to our panel. We did a great job. So this is just one portion of RiverWoods. There's still so much to talk about and so much to see and kind of experience here. So, but now is the time for questions. So just to know everyone has those cards and pens on their table, definitely fill them out. It can be specific to healthcare, it can be about RiverWoods generally, it could be about something completely random. But definitely put it up in the air, we'll come around and collect it and we'll go through it, but we'll take a minute or two. I do want to, our next event, and this is a really special one. So this is held once per year, and it's the financial risks and rewards of choosing a CCRC. So this has been well received every year we've presented it. There's always been, multiple questions asked, and you might find that some of them you didn't even think to ask. So what you see on your screen is a QR code. So to anyone that has a smartphone, just pull up your camera app and hold it up there, and that will lead you to the registration link. We do also have a sign up clipboard that was at least at the main entrance when you walked in, but if you want to sign up for it, just here now, pull us aside, we'll get your information. All right, so questions. All right, so the first question I see is about RiverWoods. So are internet and basic TV included in monthly fees? So it's kind of a two-part answer. We have started to offer a bulk Comcast cable plan to residents and apartments. So we try to get everyone's favorite channels. So if you want to add additional channels, there would be a fee for that. But basically, you call Comcast and we have a representative to create an account, and then you get a bill, but it's a bill for the best price ever, $0. And that's just to make sure that we're providing that service to your space. For internet, all spaces have sort of actually it looks like that, right on the ceiling. And so you have your own internet password for your individual living space. You can easily stream things through that service, connect to Roku TVs, things like that. And that's included as well. You do get, upon move-in, a half hour with our IT person, just to make sure that all your devices are connected properly. So that's a great feature. But hopefully that answers the question in detail. How does RiverWoods Manchester provide for minor living assistance for independent living residents? Karen, I don't know if you wanna take that.
Could you repeat that, because I think it's part of what the question I've got.
Sure. How does RiverWoods Manchester provide for minor living assistance for independent living residents?
So we have an enhanced living program, which is a small fee for service. So if someone needed help with putting on TED stockings, because that's a big one around here, they're very difficult sometimes to pull up. We can provide service for that. I mean, it can be, we try to meet your needs with a customized care plan. So it depends what your need is. If it's something like you got out of a recent surgery and you needed some help with therapy to get back to your baseline, that would be PT or OT that can assist with that, and usually is covered by your insurance for a set amount of time. If beyond that you decide, you felt that you just needed help, shower assist, things like that, we can certainly provide service for that, because the women that work in the enhanced living program are licensed nursing assistants, so they are able to assist with activities of daily living. Does that answer the question?
Is there a small fee for that service as well? If you need assistance with
Yes.
bathing or stuff?
Yes, if you need assistance with bathing, dressing, or grooming, and it's outside of your window for your physical therapy or occupational therapy, if it was more of like a standard continuous service, then yes, that would be fee for service, but it would be maintained in your independent living apartment.
Okay, and that's a fee based on an hourly?
It's an hourly rate. Some people only need a half hour. It's what you need, yeah.
If I could just add to that, in my experience, sometimes residents have chosen to, maybe hire a private companion to provide some of those services through an external agency. And generally those rates are higher. And generally there's a requirement of a minimum of 2 to 3 hours of service per day. So here, if you're only needing that half hour of service, that actually is kind of beneficial to go through our program. And they're fantastic.
And the service is flexible, so, sometimes we have residents that request first thing in the morning, we have residents that need laundry services and, they'll come in and start your laundry and then go back. I mean, it's pretty flexible based on need.
This is all kind of hitting around the question that I'm trying to express. If you're in the cottages and long-term care ongoing is required, is that covered, or is that something that you will help us find? You'll help us find a person to do that would be paid for by long-term care insurance?
Yes, it depends on your policy. Like, I don't know if your long-term care policy is going to cover for enhanced living services within the community. I'm not familiar with that. Do you?
Well, I like to say if you've seen one long-term care insurance policy, you have seen one long-term care insurance policy. They're all written a little bit differently. There are some that do allow for, if you meet certain criteria, to be covered, have some benefit for in your independent cottage, apartment, home. And generally what they require is that you're receiving services through a licensed home health agency, which we have. So
in other words, RiverWoods would be able to cover that, and then it's just a question of whether we already get that covered because the RiverWoods members and paying yada, 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 as opposed to, oh no, this is a little bit more, so you need to go into your long-term care insurance.
So a few stars have to align. One is that you have to meet the criteria. I'll tell you, most insurance policies have a 90-day exclusion for once you meet the criteria. And then they typically look for somebody to need help in 2 areas of activities of daily living. And either that based on needing some physical help or some oversight because of perhaps a cognitive diagnosis. And then for you to be receiving those services under the provision of a nursing care plan through a home health agency, not a home care service provider, that's a different thing. A private companion is different, but through a home health care provider licensed in the state. So we do have that license. So if you met all of that criteria and were able to receive those services within the scope of what we can provide, then yes, I think is the answer. But I do like to say it depends, because there's always some variables.
All right, this is a new mic. Can everyone still hear me? All right, so the third question on this card is for the respite care, are the up to 30 days an annual service or in your lifetime?
They are annual service.
And it doesn't mean that if you needed 32 days that, you would necessarily say, best of luck. It just means that, you have a daily market rate after that point. So, yes.
What if you need permanent long-term skilled nursing care? Do you have to disconnect from RiverWoods to get that?
So the question was, if you need permanent long-term skilled nursing care, do you have to disconnect from RiverWoods? So I'm gonna.
Once you require a more level of care, nursing home level, yes, we would have the social worker with us. We'd work with you to find placements.
So I'm not sure if the question is about skilled nursing care or long-term care. Because-
Permanent long-term nursing care.
So we have a nursing home license and assisted living license. And assisted living, actually, we can provide nursing level of care long-term, and we do that here in our lodge. Skilled nursing requires you to be a Medicare provider, and we are not a participating Medicare provider. So I think that's where, I think there's a lot of confusion in the community very often around those terms, familiar to us because we're doing it day to day. So for skilled nursing, as a Medicare beneficiary, you are required to have 3 days overnight in a hospital, admitted, not under observation. They play games with you, make sure you get admitted. And so 3 days of admission. And then if you had a daily skilled nursing or skilled rehabilitative need, then you could receive those services in a skilled nursing home that's a Medicare provider for upwards of 100 days, providing you meet that criteria daily. And the benefit is that your Medicare will pay for the first 20 days at 100%, and then after that, they pay a percentage of it, and then it goes to your co-insurance. So we're not a Medicare provider, but we do have a nursing home, so we can provide the care. We just can't bill Medicare for those services. So sometimes folks are really wanting to use that Medicare benefit and would benefit from going to a skilled nursing kind of intensive rehab. We can provide rehab here. We can provide that level of care. Sometimes we have folks who are admitted, they've been in the hospital for 3 days or more, not admitted, under observation. They can certainly come to us and we'll provide that nursing and rehab that you need. So it's really more of an insurance question than are we able to provide the services or not. Does that make sense? Because it is a little complicated.
So then it wouldn't be a bad idea to have long-term sort of care insurance. In addition to paying for.
Yeah, so the long-term care insurance, I'm gonna go back to if you've seen one policy. Generally, I think what we tend to tell folks is, if you're moving into RiverWoods, hold on to your long-term care insurance policy if you have one, for a year, at least. Rarely do folks leave RiverWoods, but if we weren't for you and we are essentially your insurance, product once you move in. But certainly, again, there are folks who hold on to their long-term insurance policy with the hopes of if and when I need healthcare. And then if I do need healthcare long-term, if and when I meet that criteria, that my insurance policy will reimburse me for part of my monthly service fee, then I can use it. And we do help people with that when there is need and they meet that criteria, with getting everything that the insurance company needs. They're in the business of not paying, So it does take a little bit of work, but certainly there are folks who successfully, use their long-term care insurance here because they need long-term care and they're in our lodge receiving that.
So is it a good idea to get long-term insurance?
I don't know that I would advise you on that specifically, probably a question outside of here, but I think that's an individual decision. I know a lot of folks who've had long-term care insurance and they move here and think, I have what I need, I know what it's gonna cost me. And so I choose to not pay my $4,000 or sometimes $5,000 a year for a long-term care insurance policy. What I have seen, and I've recently just met with a number of residents, looking at their policies with them, is that the rates keep increasing because nobody in long-term care insurance was quite frankly expecting the lifespan to increase, and nor were they expecting that the health span wouldn't quite match. So folks living longer, not always as well. And so they raise their rates.
Okay, we're in the hospital for 3 days, we have to go to rehab. And the Medicare will cover 100 days. What happens to you when you're living here? You're still paying your monthly fee?
Yes.
Okay.
So just to repeat the question so that everyone can hear, the question was, you're a RiverWoods resident, you're in the hospital for 3 days, but you have insurance that covers 100 days. Are you still, of rehab, sorry, are you still paying the monthly fee here? And so, yes.
And just to be clear, plenty of folks who are admitted directly into our lodge for services, short-term or long-term. Folks who are out to the emergency room may need to come in for short-term or long-term services in our lodge. Folks who are admitted to the hospital for 1, 2, 3 days or more, who may come directly back to our lodge for short-term or long-term services. That skilled nursing part is really, it's utilizing that insurance benefit on your Medicare plan for Part A skilled nursing. They will pay for upwards of 100 days if you meet all the bells and whistles, that 3-day and admission and all of that. And again, they're trying not to, right? So make sure you're getting admitted and not observed. And then you can use that service for up to 100 days. It doesn't mean you get 100 days automatically. You have to still meet that daily requirement. And then if you use those 100 days, they want you to have 60 days of wellness before you get another 100 days that's available to you in that calendar year. I went to nursing school. This is what's become of me, honestly, I don't know.
So to stick on a healthcare question, this question we get every time, but it's important, how was RiverWoods Manchester impacted by COVID-19 during this pandemic?
I think I might have been the only one here during that time, actually. I'm gonna be honest with you, it was incredibly difficult. I remember years ago, I was traveling to the Caribbean and my father said, Cindy, you gotta watch out, it's an entirely different sun down there. And I didn't know what he meant by that. And I got down there and I burned right away and it was very strong. That was a different COVID. That was a different COVID that we had early on. So we had our first cases of COVID here in April of 2020. And when we first heard that there was a pandemic, I immediately moved from Exeter over to Manchester, thinking this is where we're going to actually get hit. And it's just the nature of being in a city. It's the nature of, generations of people living in close quarters in apartment buildings and all those things that you see in a city. And it was hard because we were struggling without having easy testing. We were struggling without having antivirals, all the things that have come since. The good news is that we are a family of communities and we do the right thing by folks. So we partnered with Convenient MD who could do testing to come on site and tested everybody in a lineup. Residents and staff, some 2,000 people between Durham, Manchester, and Exeter. And we paid them to come back and do it again. And folks weren't doing that, so we were able to easily detect some cases. And I think that helped us. As far as personal protective equipment, that was a challenge, as you know. I don't think anybody expected that that coronavirus, the pandemic would have started. We're 70% in Wuhan, China, where they provide all of the personal protective equipment, gowns, gloves, masks for all of the countries. And so having, that PPE was incredibly important to us providing the best care and keeping folks safe, keeping ourselves safe. Those were some challenging times. I remember I was, constantly on the phone with folks that we have partners with at local hospitals. They were helping us. We had a vice president of special projects. I believe he was doing some black market deals off the highway to get us PPE. It was amazing. So as dark as it was, we were in a better position than most. And, we had certainly many cases, and we continue to have sprinkling of cases at times because it's just part of our community. It's hard to keep out.
And specifically, how were the residents impacted during the worst part of it?
The worst part of it, they were impacted, I think, mostly by isolation. It was so hard because we were having to meet the regulatory rules of we couldn't have visitors come in. So that was incredibly heartbreaking to see a separation between what was independent living and the lodge healthcare, to not be able to allow for some time family to come in and visit. That said, if we did have somebody who had COVID, or perhaps was maybe, end of life, we made sure we got families in. We just put them in full PPE to make sure that they could visit. We did telehealth visits. We did lots of visits with family through iPads. We did visits through windows. We did socially distanced parades outside in the parking lot. So we did everything we could to be creative to make sure that families could see folks, but it wasn't like it is today, and it certainly wasn't like it was prior to COVID.
How about commingling of independent living residents here?
Commingling meaning the independent residents,
Yeah.
They were certainly not isolated. They were commingling, and we certainly had some COVID cases in independent living. We were rounding through doing testing. You would have seen me at the time coming through with a cart, doing test in my full PPE. Life goes on. When people made choices, we didn't want to shut down the world. And so you start kind of balancing off, and people made choices for themselves of maybe I want to be less social, or maybe I want to go to the tavern and have a little drink. So, and everything in between. So it really came down to some individual choice, but as people were identified as testing positive, then we would enforce the isolation rules.
You answered my question.
Okay.
Just to be on sort of a reassuring level, I was not here during the pandemic, but I did work through it. I was a memory care director at the time. And everything that Cindy is saying is, what was happening in the world. So it didn't happen just to Manchester, it happened to everyone. So we were all learning together, we were all adapting, we had fitness in hallways, to try and get people active. We were really trying to adapt to this really unknown circumstance. So, it's not just Manchester that was impacted by COVID, it was the whole world.
The world.
So, yeah. All right, so this question is for Felicia. Is there a cost for the trips and events on our calendar?
So there is no transportation cost if it's a scheduled trip that we do. The costs that would incur is if there's, a dinner, your restaurant would be on you. If there's a ticket purchase to go to a show, we would do that and then charge that to your house account. But the physical transportation for our trips, there is no cost. We do have, and then that also includes no cost for our shuttle. So we have the shuttle schedule that Katie referenced. Monday through Thursday that we go to certain zip codes. And if you have an appointment or you want to go to the grocery store on those days, that is, there is no additional cost, but we do have special transportation. So if you have an appointment on a different day that we're not going there, there is a fee incurred to take the transportation there, but we'll work with you on that.
And then the second question on this card is for Karen. What are the hours of your wellness clinic?
Our wellness clinic is open about 8 to 4:30 every day, Monday through Friday.
This question is for anyone that wants to take it. Do you coordinate with the VA for care services?
I'm not exactly sure in what capacity, but if it meant your VA doctor sending out orders for you to have PT and us to arrange that, then yes, we would help coordinate those services.
So we work with the VA a lot, in a lot of my locations as well. I'm not sure if you guys know me, but I quit. Depending on the type of VA benefit you have, some you don't need anything. It's very easy to coordinate with the doctors. There are a few that if you get all your services through the VA, with the hospital, everything, then you would need packets for outpatient services. We help coordinate with that. So if you did need PT, OT services but didn't feel like you could get to the VA, medical offices to get that services directly from them, then you would submit for a packet and we can help walk through that. Then when you have those packets, they will cover you fully for rehabilitation services. And again, everything we document, evaluation, everything will go directly to your VA doctor then, your primary care or the specialist that's referring you.
So actually, for your counterpart, does VNA allow one to use their long-term care benefits?
So that is something that we would have to individually look at. Every person that gets a referral, we will check what the insurance is and if we are contracted with them. So that would be something, if there was a referral, we would let you know after we checked it.
Just kind of as a follow-up to that, there are probably a lot of veterans in this room. I count myself in this category. We don't really have any concept of what the VA can do for us. Is that something that you have some knowledge in and can help us understand what we can maybe, we get?
So at the VNA, I don't have anything that I can give you specifically. I will tell you that there are people at the Elliott Hospital, and I would be willing to find out, get that contact information. They would be able to help you with that.
I can add on to that. Sure. Your question is good timing. We have recently partnered with the VNA, and they're coming in November to do a presentation, and provide resources so that we can have better knowledge and a contact for veterans.
And that would be for you, not for the group, or would it be for the group?
No, they're coming to speak directly to the residents, and then we would obviously have the contact as well. So you're not here for the presentation, we can provide a contact for you.
Awesome. So this question is sort of a what if. So are there circumstances when the lodge, which is again assisted living, memory support, and nursing care, cannot provide care and a resident needs to go elsewhere?
We do currently have 2 respite rooms. The only time that would happen is if we have residents that are accessing those 2 rooms. We do have sister campuses, communities in Exeter and Durham. So we have offered the resident to have the respite visits if there's availability at those other 2 campuses. There are certain requirements by our regulations. We don't do IV therapy. So if you do require IV therapy, that hopefully will, if you access your 3 midnight stays, like Cindy said, you have the opportunity to get these skilled services provided in that care setting. I'll be honest, we do colostomy care. We can provide, more long-term care needs. But there are certain things that we cannot do. And as I said, we only have the 2 respite rooms. So we will offer you our other campuses. Anything else you need to add to that?
This has not come up, but I've been asked the question if we would provide TPN, which is nutrition through an IV. And we would not do that. It would require pharmacy and lab and physician and dietitian on a daily basis to coordinate what that looks like. So that's not something that we could provide. I've been asked if we would provide ventilator. If somebody was on a vent for life support, and that would not be something that we would safely do here. Those are just special units and they are far and wide. And the only other thing that comes to mind is, on occasion, we may have somebody who has dementia with some behaviors that are not safe to themselves or others. And then we would coordinate, we certainly would try to manage that here, but if we had to, we would work with Generations mental health support through the Elliott Hospital or another geropsych support to get the acute care that they need with an aim of returning to our lodge.
All right, so this is for everyone. Could each person give a summary of some of the additional charges for what they offer? Specifics or ballparks?
So my services, if you came to see me for a medical concern, are inclusive in as part of your contract. So I don't bill Medicare if I treat you or anything like that, for my NP services. If you needed, enhanced living services, the cost is $35 an hour or $17.50 a half hour. And again, that's a flexible time frame.
So, for community life, for fitness, all of our classes, the fitness center, our group walks, those are all included, but we do have personal training, which is $35 for a half-hour session. When you move in, you have a complimentary wellness session with Megan, our fitness coordinator. So if you are more of an independent and don't want the personal training, she'll go through all the equipment and answer any questions there. And then for transportation, like I stated earlier, there is no fee for our regular scheduled shuttle or our trips, but if there's a special transport, it's the $35 for the hour, and then the half hour and so forth, it's obviously deducted. And our IT services for all the residents is included, so the only additional fee would be if you needed a new cord or something, we can coordinate and order that for you and charge it, but our IT technician will create an appointment and will come at no additional charge. And our salon is an additional charge directly with our contract stylist. So you can get a manicure, pedicure, any hair color, cut, perm in our salon, and that's an additional fee. And then the massage therapist and any other spa treatments we have is $100 for the massage. It's $100 for the hour. It's zero balance massage, and that she comes every week, so you can schedule appointments with her.
Additional services that come to the wellness, like podiatry, dermatology, and audiology, those would be insurance-based charges. Or they would tell you in advance how much they were charging you for service. That's separate. It's kind of like they're here as a courtesy, and they're not like RiverWoods staff. So that would be like a regular doctor's visit for you.
And the same thing holds true for the lodge. If a resident requires accompaniment to a doctor's appointment or to grocery store, we do charge $35 an hour. If it requires a licensed nursing assistant just for safety reasons. So the same holds true for the lodge services for the escorts. It's upon availability, so we have to know as soon as possible when those appointments are scheduled so we can accommodate those visits to mostly it's the physician's offices.
I come at no fee, so there's that. No, the only thing that I can think of is that, we also have X-ray services that come on site, lab through the Elliott and CMC. We mentioned Generations Mental Health. There might be medical providers coming on site, and those are all insurance-based things that we're not charging.
Yeah, we're all Medicare Part A, and we have a whole myriad of insurance companies that we are contracted with as well.
For our PT/OT speech services that are skilled, that is under Med B. Med B typically pays 80% of this, and that's where your secondary insurance will come in. Every secondary is different. If you don't have Medicare and you have an Advantage plan as well, you may have a co-insurance, a co-pay that comes with that. Those are all insurance-based services. The additional services that CPT also offers outside of insurance is after you've gone through skilled therapy for the Hydro Work Rise, you can then schedule with our fitness program to continue using the Hydro Work Rise with a fitness instructor. Again, same fees as across the board, it's $35 for that session. And then same as if, say, you really like PT, you wanted PT, but it's no longer skilled, we do offer private pay, PT, OT, and speech services after that's deemed not medically necessary by your insurance. And those rates vary between, if it's a 60-minute session or 30-minute, they run from $65 to $90 an hour.
And then just on a, moving into the community base, there are some options that are considered upgrades. They, are not requirements, but it's available to you. So we do have covered parking here. That's a $50 a month charge. Some of our apartments have their own patios or balconies, which is an additional $50 a month charge because it's more living space. So there's a couple of things like that as well, just in terms of your own specific wants and needs in your day-to-day here. So the last question, which I think is a really important question, especially if, we do have some people that are already on our wait list here or excited to move into cottages. But the question is, when is it too late to move into RiverWoods? And I think it's a two-part question. So I'll answer it in my own perspective, and then, if we want more specifics to help, we can answer it that way. But basically, there's no such thing as too early to move in here. Our minimum age is 62, and we have 62-year-olds here. The purpose of a CCRC is really that peace of mind. So, things happen at any age, and we're working with crystal ball moments. So what better way to get ahead of that than moving into a community that can maintain your care needs if you find yourself needing them. So, do it now. People constantly say, I should have done this years ago. And there's reasons being, it's not the old school mentality of a retirement community. It's you being super active and independent and just you being in control of what your future looks like. So, Karen, I don't know if you want to add to that in terms of, moving into the community, if there's stuff to kind of, if you.
I will say fun fact for statistics is that the average age of an individual moving into a need for more skilled nursing is ranging around 87 now. So when you look at that advantage of 62 here and all that time you can get socialized, stay active, you're just going to keep pushing that number up and up because people are going to be able to stay and enjoy their independence longer.
I have a question. What is the procedure to apply to move in?
So I can talk about this. So the question was, what are the steps to actually apply to RiverWoods? So we are working with a wait list right now. So you have to kind of determine what space is of interest to you. So if you haven't gotten an information packet that has our floor plans or pricing, definitely reach out and we can give that to you. Once you feel confident, you would first complete a financial assessment. So the financial assessment looks at basically all the possible scenarios you could encounter in your life. We use an actuarial software program. So it looks at, what's the largest floor plan of interest, what is the economy and its inflation, what are our annual increase expectations, what is your statistical life expectancy plus 2 years? What if you needed nursing care tomorrow? Because we want you to be able to not worry about finances here. So we put that into a software program that gives us an answer. And then after that point, it's based on if something is available or if you're looking at a wait list. So to get on our wait list, you do not yet have to do a health assessment, but it will be required prior to moving in. That health assessment has 3 components: of functional, balance, and cognitive aspect to it. So if that's of any concern to you, do it on the sooner side. But if you are waitlisting, you would then deposit 10% of the largest entrance fee you are interested in. You can put your name for more than one floor plan, but you would only do one 10% deposit. That deposit earns 4% interest while you are waiting, and it will get credited to you when you go to pay the balance at closing. To move into an available space, we would then move to the health assessment and complete that, and then you can deposit the 10%. And then for an available space, it is a 60-day close from when we offer it to you. Okay, so it's a lot of information, but if you have any questions on that, definitely let us know. So it looks like we have 2 more questions.
I've already done the medical and the financial assessment. Now what?
So basically, so I'll actually come to your table specifically and have a chat with you. Just because it's individual based, okay? And then we have another question in the.
What is the average wait time for when you first apply?
So, from when you first apply to when you hear back from finance, or wait time of our whole waiting list?
The whole waiting list to get into RiverWoods.
Sure. So I'll answer both just to cover it. So once you send in your financial assessment, we can put in that data same day unless it's 6 p.m. on a day or something. And then it usually takes within 5 business days plus or minus. If we're in budget season, it's going to be a little bit longer because our whole finance team is dedicated to figuring out all the statistics and data in that regard. But it shouldn't be too long before you hear back. And then for our waiting list, it definitely depends on the floor plan. So here at RiverWoods Manchester, since it was an affiliation, the rooms were already here. So we have more of certain floor plans than others, and we have people on our wait list. So that definitely changes things. For our largest 2 bedrooms, that's about a 3 to 4 year wait list. We have small 2 bedrooms that are maybe a year to year and a half. And then our 1 bedrooms kind of range as well. There's one floor plan where we only have 4 of them in the community, 3 of which were moved into not that long ago. So that's going to be another 3 to 4 years. But then we have others where we have 32 of them in the community. So that might be about a year. So the wait list is flexible. So if you're not ready yet to move in, but ready to get your name on a list, I highly encourage it, because then you can kind of tailor it to if something comes available and you just say, I'm not ready. That is okay. You don't get penalized for that. Right? Yes.
I just keep seeing this picture.
Yes.
Beautiful picture, and I'm seeing these 2 mountains in the distance, and I'm wondering, it looks to the northwest, and what are those mountains?
I'm actually the worst person to ask as a Massachusetts resident.
Those are the Uncanuna.
Yeah.
Yes.
In Goffstown.
Thank you so much.
Way to go, Kevin.
They're not really mountains, but.
Yeah, everything is relative.
They're like a straight up tip.
But this was taken, I think, at like 5 a.m. via drone, and it definitely is a stunning photo. And it's really neat because, you hear Manchester, and this is probably not the image you think of when you hear Manchester. So it's kind of the best of both worlds. You have all of this 640 acres next to you, mountains, hiking, kayak, etc. But you're also minutes to downtown, so you've got theater, restaurants, museums, and everything that comes with that. So it's really neat, and it fits introverts and extroverts alike. But this is an incredibly welcoming community, and we hope that you see that, and we hope that you join us. So with that being said, I'm sorry, yes.
Easy question. What is the charge for a pet?
So we do have a pet policy, we love pets here, and it goes over all of the necessities for pets. So we would need to know who's the veterinarian, who would take care of a pet in an emergency, are they up to date with any shots or medications needed? But really the only charge is that you need a sort of a renter's insurance policy for your pet. So there's a minimum coverage amount that you have to have included in that. Renter's insurance is not that expensive though, and it's usually based annually. I need it for my own space and I don't even have a pet. So you can just even do a simple Google search and they'll give you a quote, and you can get that insurance literally in 10 minutes. But that's
There's no fee here, it would just be a rental.
correct. And if you want a copy of the pet policy, we can share that with you. Yes.
Do you provide assistance to find a PCP in the area?
So I think, do you want
So when people move in, we have an orientation packet with each of the leadership team. And as part of that packet, I do give contact for PCPs and supportive providers.
And sorry, one more important add on to the pets. We are actually just finishing creating a dog run, which is behind our covered parking, and it was all resident suggested. So that's a cool feature we've added to the community.
Can you get a pet once you're here? If you move in without a pet, can you get a pet?
Yes, so same policy still applies. So you just need to make sure that you have that renter's insurance and that all the information is filled out. One other thing is, pets have to be amenable to community living. So if you have a shepherding dog or a dog that, howls at every person all the time, probably not gonna be the best companion in your space, every day. So that's part of the pet policy as well. But dogs, cats, we have a parakeet named Indigo, we have a blue-tongued skink, which is a type of lizard, here, so we love pets. Any other questions? Bueller? Oh, yeah. So actually, our next event for colleges is the contract review and construction update. So you will get, and that's October 3rd, so that's coming up very shortly. So if you want the next up-to-date status on the buildings, that would be my recommendation.
So I thought that was today, that's why we came.
Oh. I'm so sorry. Well, you got a lunch out of it, so. But any other questions for either myself or our wonderful panel? Yes.
Where does your transportation go?
So, yeah.
So, our scheduled transportation goes to numerous doctor's offices, Market Basket, Walmart, the mall, and then trips are, we went to a casino, we've gone to Tanglewood out in Berkshires, we go to Manchester Palace Theaters, Concord, and then we will do every other month, we've been implementing going to different small towns in New Hampshire, kind of doing a day in it, shopping and lunch, so we'll go to most places.